Thank you. Sorry, Sam, did you want to...
Are we okay? Are we back on?
Are we back on in some form? All right. Okay, thank you. Sorry, Sam, did you want to carry on, please?
Thank you, Chair. So this report complements the one that we've just gone through, so it's for the same period, October 24 to March 25. Committee are asked to note in the report the details that supplement the details we've just gone through in the previous report. Thank you.
Thank you. Any member? Councillor Atwell?
Yeah, just one question. I think it would be interesting to see whether it's possible or not, and you can go away and look at it. I'm not expecting an answer, yes or no now. But for example, I'll take an example of the youth service. There was you had to pay out 2,700 for redundancy in the youth service. But as that role is now not going to be in place, there's obviously a saving associated with that. It might be useful to show the savings. So if the person was paid 20 grand a year, it's actually a £1,700 saving rather than a £2,000 redundancy payment. It might be useful to put a savings column in there so everybody can understand that it's actually a saving to make them redundant rather than an on-cost. But whether it's GDPR compliant and all the rest of it, you need to go away and look at it. But it might be useful to do something like that.
Go on, Sam, do you want to respond?
Yeah, thank you, Councillor Ackwell. So each area we go into in terms of a reorg, there has to be a business case to make it cost effective. So we don't have an on-cost pot that would cover this. So the service normally when they're doing a reorg would be built around efficiency. So we have that information. I'll just take that away and seek whether that's something we can put in a public domain. If not, it might be something we need to share in another way, perhaps through the portfolio holder one-to-one, something like that. Thank you.
Okay, thank you. Any other member? No, move to the Vice Chair then, please.
Thank you. So other than that discussion around the possibility of showing savings associated with changes in role, the committee's asked to note the report.
Thank you. Is that seconded?
Seconded.
Thank you. Is that agreed? Agreed, thank you. Okay, thank you. Item 7, Learning and Development Strategy 25-28. Sam, to introduce the report with Selina as well, please.
Thank you, Chair. So this report presents the proposed learning and development strategy for 25 to 28. It aligns with our workforce strategy, which you'll be familiar with, and includes areas around talent development, succession planning, onboarding, leadership, management development, inclusion, diversity, wellbeing, digital transformation and reward. We have a mixed approach to our training. This is primarily done through in-house subject expert matters, as well as e-learning, and we make maximum use of our apprenticeship levy. Where it's necessary to procure training externally, which we do this through the Council's procurement and compliance requirements. For a part of background here, in 2018, the learning development budget was reduced from 513,000 to 228,000 by 2024. Last year, we put in a business case for our medium-term financial planning, and the budget was increased this year to 456,000. This is predominantly to meet the demand and the increase around mandatory, statutory and legislative training requirements. But we also need to ensure that we can support the career development through the MedPay performance progression and pay framework. The budget is fairly small, and previously this was done on an ad hoc by directorate business case basis. From this year, from April, we've been going out to directorates, working with management teams to try and look at prioritising the use of that training budget against the strategic objectives and professional qualifications that we need to do, noting that the Level 7 apprenticeship levy will come to an end in January. Appendix 1 outlines the L&D strategy and lists the actions that we will be taking forward, and committee requested to note that the strategy is set out in Appendix 1, to note the key proposed actions that we need to achieve in order to deliver this against this strategy, and also invite you to propose any other improvements or associated key actions you feel it might be necessary for us to look at. Thank you.
Thank you. Any member? Councillor Fern?
Thank you, Chair, and thank you, Sam. Obviously, welcome the increase again in the learning development budget. Obviously, we want to invest in our staff and train them to the best standard and try and retain them. In terms of allocation, how are we looking at the moment? You said that it was going to go out to directorates to sort of bid for the funds, if you like. How are we looking on that? And then how you said about prioritising. How are you going to prioritise them? How do you decide that? And if the budget's fully spent, then there's some sort of urgent training to do. Is there any scope then to get additional funds to provide additional training?
Yeah, thank you, Councillor Fern. So we set up, if you like, like a survey that went out to all service managers, and the survey explored what training might be required, both from a legislative, statutory, but also from a MedPay point of view. And we asked service managers to come back to us on that detail. So that was kind of like our first rough pool, if you like, of what everybody wanted. You wouldn't be surprised to know that what they wanted breaks the budget. Instantly, and Selina might want to come in with a bit more detail in a minute, Selina and the team have been going back to the directorate areas now and I suppose critically challenging some of the assumptions that people are putting forward. And an example to give, for, if within the career framework it says that you need to be qualified as a first aider, is that everybody, or is there just one or two people that need to be qualified as a first aider? And what service managers have done is they said, I've got a team of 10, they all need to have it. Do they all need to have it, or do we do a phased approach to it? So again, it's trying to get maximum capacity, I guess, within the budget to do big numbers so that there's a lower cost, but only in the sense that we actually need that training to be delivered. So we're probably in the middle of a lot of tough conversations at the moment. And if you don't mind, I'd just like to bring Selina on just to kind of update the cost of what we've been asked for against the budget that we've got and the challenge that we have, just to articulate that.
Sorry, the total known request where we do know what the cost is comes to 428,373. We've already got some commitments on our budget for other training of 152,000. So that kind of brings us in at around 581,000 if we added it all up together, and that gives us about £104,000 overspend. That's before we add up any of the costs that we don't know of. I am challenging, as you said, health and safety is a nice and easy one. So first aid, we have a set number of first aid that are required by law. So I'm working with our health and safety manager to work on that one. And we also challenge in terms of, is it something that can be covered under the Apprenticeship Academy? And our policy does state that if there is a policy, that if there is a standard that aligns through the Apprenticeship Academy, that is the route that we follow. And so I'm having those conversations at the moment.
Yes, please, sir.
And then thank you, Selina. And then just to answer your other point, Councillor Fern, around if it goes over, what are you going to do? We anticipate that we will be going over, or there will be a change later on in the year that means we've got to respond to some sort of training that we haven't accounted for. At the moment, we're working through next year's pressures. So anything that is appearing to be a risk within any budget at the moment, we're working with finance colleagues on identifying what those pressures are. Because we're in a financial hardship in terms of the exceptional funding that we've drilled down, we do have a fit plan in place that is looking for additional savings. So when we've got all the pressures on the table, it will be a bigger prioritisation against other organisational issues, and we might get to a point where we won't be able to fund everything, but that will go into the mix against other pressures to see where we're going to get that additional money from. And again, there's other incomes that are drawing in. So if I take my team, for example, we work with the agencies. We've got a lot of agency staff coming through. We've predicted that we will have a decline in that income because we won't have as many agency staff. However, our turnover is still very high and we're still bringing in very, very many agency staff, which means that income will still be slightly higher. So again, the budget will be monitored monthly to reflect, and we will reutilise any budget that isn't putting in as a savings target to accommodate any areas of pressure.
Yes, please, Selina, yeah.
Thank you. Through my conversations, what we'll actually find is there are going to be cost savings made. We're at that scoping exercise. We're asking people to think about that long term. So it may not be this financial year that they require that training. It could be next financial year when they're thinking about where people need to be trained. But as I said, as I'm having those conversations, we're going to see a change in that budget because that requirement might not be there.
Thank you. Do you want to come back, Councillor?
Just one point. Thank you both for that. So do we have a training matrix of every single role and minimum requirements and stuff? For our staff. So do we at least get to those minimum requirements?
Yeah, thank you, Councillor Fern. So we have a list of the legislative, statutory and mandatory stuff that we must do. So that's already mapped out, and that's the known costs, if you like, because that's stuff that we have to do. We already know how we're going to deliver it. What we have now through the MedPay is the career frameworks that tell you what kind of qualifications or experience or training you need. What we haven't got is one centralised area of that, because not everybody's gone through MedPay yet. And again, so, you know, because we're doing the evaluation of MedPay, some of the stuff we're identifying is, rightly so, L&D are saying, is that an actual requirement or is it a nice to have in your framework? So there's some, you know, gentle pushback and constructive challenge coming from L&D colleagues to say, might be a nice to have, but when we've got a small budget, that will stop somebody from progressing if that's in there and we can't afford to fund it. So those conversations are ongoing. So we don't have a nice shiny thing that says this is what it is at the moment, because we're going through that same conversation. But the aim is we will have that for each kind of career pathway. There will be a list of requirements and training, and that will help us then plan our spend for the following year.
Thank you. Councillor Hackwell.
Thank you, Chair. Yeah, a couple of questions. We've obviously doubled the budget for this year. I know you said actually that's like it was the previous years, but we've sort of come back to the norm. Apart from the mandatory training that we have to do, how are you going to measure the outcomes of the additional training? So, I mean, for example, are you going to have reduced staff turnover, increased internal promotions? You know, that because we're investing a lot of money. What are we actually? How are we going to measure whether that investment's been good, or should we really be going back to where we were before? That's one question. And a question in a similar vein. You sort of talk about wellbeing modules and things like that. How are you going to measure that if they go through the wellbeing modules, that actually has reduced stress and the outcome is good? And have we got a current baseline for stress-related absences at the moment, if you want to reduce those? So how do you, my real question is, how are you going to measure the effectiveness of this investment and training?
Thank you. Yes, please.
Thank you, Councillor Hackwell. So with all of our courses, we'll do an evaluation. That's the first thing, around whether or not what people are thinking they're going to get out of it, they're going to get out of it. And then we will go back and revisit that as well to see if that has had the desired impact. The two you mentioned there, particularly around wellbeing, that will be measured around the mental health and stress concern and anxiety concern. And we do have a baseline. So by teams, we have the levels of stress and I guess anxiety or mental health concerns that are within those teams. And for us, there's also other measures around that. So we have a mental health champions network. We really need to invest in those mental health champions so they can have better conversations with individuals and free them up. So we'll be taking some of that softer feedback from them around the interventions that they've made and whether that's resulted in somebody not feeling they're not getting the support or they've gone off. We also do the staff survey. So there's a number of questions in the staff survey that go around the training and support that you get and if it's relevant and if it's made a difference. I suppose each course is so different, there will be probably a different measure we will have to apply to it. Another one we've got at the moment is a complete Medway manager. So the HR have a section on that, and that goes through a lot of our policies around sickness, disciplinary grievances. So one of the measures on that is if a manager's been through that, are they applying the policy right? Are we still seeing those cases come back where they've dropped a ball and it's not appropriate? So each one's got probably a different measure on it. I wouldn't like to say with the array of courses we've got them all locked down with measures. It's probably the ones that we drive internally that we're measuring better. The kind of external ones, we get the evaluation, and we rely on the managers to determine whether that post-course briefing was what they wanted and it was going to make the difference within that service area. But most definitely our internal courses will have a desired outcome. I think, you know, within the action plan of the L&D strategy, there's a number of things where we say we will measure some staff. How we get that information, how frequently we still got to work through. You know, how easy is it? So I know L&D have a lot of information. Do we use it well enough and do we analyse it well enough? Probably not. So there's those kind of things, because again, we've already given that commitment that we will have to prove the value by increasing this and then the impact back to the business. So what is the value back to the business? So we've committed to go back to corporate management team with that, and that will be an array of measurements that we'll put in place.
Thank you very much. Councillor Cook.
Yeah, thank you. Yeah, really echo what's been said already. In fact, I've just crossed my first two questions off. So, you know, real agreement there, and, you know, really fantastic, exciting policy, and thank you for sharing and the work on it. Really interested in use of apprenticeship levy. I'm run a apprenticeship provision myself. Interested when you say, you know, you're always looking to use it, what percentage of levy have we actually spent? In that, how do we incorporate the requirements of off-the-job training? Does that have an impact on people's ability, obviously, you know, it's really committed to important training, but it does mean with an apprenticeship that there is a proportion of time that those employees are needing to focus on their training. So how do we mitigate that? We're expecting some changes around employee involvement in assessment. How are we just making sure that we can continue with that capacity? And are our apprenticeships predominantly early career staff, or are they used to upskill existing staff? You know, what does that look like? And then a couple more questions around evaluation and quality. You've spoken about that quite a lot already. Do you do kind of train the trainer input? What are the kind of fundamental expectations for in-house training? What are people given when they're writing internal training? And likewise, what do you look for in quality for external? Are there particular kite marks, or is it about reviews? How do you choose which providers we're going to spend our money on? And lastly, I really welcome the kind of pictorial representation of the strategy on page 60. I'm conscious that it kind of starts in September and then delivery is happening in April, and by September we're talking about the next kind of cycle. Is it a spiral? Is there room from April for it to take longer for me to be involved in training? How am I making sure that there's enough time for the coaching and the implementation and the rehearsal? You know, how, just reassure me that it isn't, you know, a quick process, but that there's real time for coaching in there. Thank you.
Thank you.
Thank you, Councillor Cook. So we've probably got a couple of answers between us on this one. I'm going to ask Selina to pick up the apprenticeship levy in terms of the percentage of spend, and then also the detail around choosing our external providers. That's what Selina's area does there. The off-job training, I've had a few people in my team go through an apprenticeship at quite a high level, and I think one of the most difficult things for me, particularly being a high level, is you have a strategic plan in place of the stuff you're going to deliver. The apprenticeship doesn't necessarily align to that plan, so trying to give people the opportunity to get involved in things that perhaps are not in our business planning for that year is proving, I would say, probably one of the frustrating things. So we're just about to onboard now 3 other people actually onto the same programme, and we've got now the modules in advance of our service planning to look at, do they align, and where there might be risk, and it's building in within our quarterly planning within my team where there is risk. How do we manage that? How do we manage that extra capacity that person has to do? And again, we've got a really experienced apprenticeship academy manager, Jodie, and she will work with all those managers on that planning piece. And I think it's really important to do the planning piece. Most definitely, with the providers that we've worked with across the apprenticeship programme, there is an understanding of the fast pace of our business and the fact that sometimes there might need to be a bit of a delay in a module or a change around in the module. And we've been quite fortunate that we've had really good working relationships with the majority. And if we have found any that haven't really blended itself to work with us as an organisation, then we'd move on to another one. And again, that's the robust management of the apprenticeship academy that we have in place. So I wouldn't say it's easy. Absolutely not. I think it's a conscious effort both on the manager side and the individual side to carve out that time. And again, part of that planning when anybody's taking on an apprenticeship is how do we get it at work, but how do you also get it at home? Because that's the other pressure, isn't it, if you're full-time working, for example. So I think managers are well supported and well versed in having those conversations, but I wouldn't say it's not without pain at pivotal points, particularly when it's busy. The element of let me just check, sorry, the coaching and the September date and that. A lot of the training we have is already in flight. We had a pause period because we had an internal trainer who retired and we had to recruit somebody new, and rightly so, our new corporate trainer wants to kind of go over the content and make sure it's fit for purpose and refresh it. So a number of courses now are already up and running. For me, we're at a pivotal point now because we've just set the objectives, and really what people are then requesting through their personal development plans is then how we tailor what the programme of works looks like as we move forward. The strategy itself goes up to 2028 to align with the workforce strategy. The bit that's unknown for us that we will need to weave in for next year is the skills gap analysis that we need to do. So what we're doing now is being very reactive to what people need because we've got the MedPay stuff in, but we generally haven't kind of future-proofed that, and that even goes into the kind of reams of LGR and preparing managers to be resistant to change, and how they're going to bring people along with them by keeping the lights still on. And so there's probably a number of things that we know we want to do, but we need a bit more of an evidence case to be able to do it. And again, the staff survey in itself, that's out at the moment for 4 weeks, that always presents us with a challenge around what we need to respond to as an organisation, and that is often further investment in topics. So I don't think we're ever been in a situation where, even though we've got a budget that's been exceeded at the moment, I don't think we're ever been in a situation where in April we go, that's it and that's all we're doing. We've kind of got moving parts to it that are going to change over the year. So the cycle in itself forms a nice picture, but it's going to be iterated as we go, most definitely. So if I can, just to hand over to Selina to talk about the apprenticeship levy funding, the percentage, if that's okay, and then also the external provider and how we choose those. Thank you.
Thank you. I can confirm we're actually on target to never give back any of our apprenticeship levy, and we've been that year on year. We have never given any money back. So as of the 30th of June, we actually have 76 apprentices in apprenticeship posts. We have 113 people undertaking upskilling programs, and the total spend stands at £3,663,645.80. So the total committed for all programmes commissioned is 5.55 million. As Sam said, Jodie works tirelessly to make this work, to ensure that we do not ever have to give any money back. She does work with those managers, and she works with the apprentices, whether those are the upskilling or the traditional apprentices. We have an apprenticeship academy where every month we work with them, we do some upskilling. This is with our traditional apprentices, giving them some life skills, giving them enhanced training that they wouldn't get if they were actually undertaking an apprenticeship elsewhere, and we're really proud of that. In terms of off-the-job learning, it is 20%, but remember, everything that they're doing is actually adding to their learning, and it's adding to us as an organisation of what they're actually bringing to it. So that off-the-job learning could be sitting in on a meeting, shadowing, doing e-learning, or some other form of training, so it's only ever going to enhance us. So in terms of our providers, obviously we do have to go through the procurement exercise. At a minimum, we have to go through 3 quotes, and it's very strict in the way we do it. If it is over a certain amount, we have to go for an invitation to quote. And again, we work very closely with our procurement team, and we make sure that we are following the guidelines. So in terms of how we choose our providers, yes, we go through our quotes. We look at who we've worked with in the past, who is good. We do look at those evaluations. We take everything on board, but it is cost and quality that make it up.
Thank you. Do you want to come back, Councillor Cook?
If I could just come back and say thank you so much, and I really think that the committee should celebrate particularly the work with apprenticeships and the apprenticeship levy, because that's no mean feat, and you know, through you, Chair, our congratulations could be passed on to the manager Jodie and the team, because I think that that's really phenomenal. Thank you.
Yeah, most definitely. If you put that in our recommendations, please. Thank you. Councillor Shoker?
Yeah, thank you. So my question is regarding the onboarding of new officers. I only know this because 2 of my friends just joined the council, so I was having a chat with them. One was obviously with the extent of the content they have to learn. I think she said it was between 35 to 40 hours. So I was wondering if there's anything we can do about that in terms of how much there is, in terms they might not be able to absorb it all. And also there was a few links not working within the training that they couldn't access, to spend some time looking for it.
So in terms of their mandatory training when they join, we have corporate training, and there are some of the things that we just can't get away from. We are local authority officers, and there are certain requirements that we have to undertake. There's about 13 courses involved, and then we start to move down to the service level. So it's whatever the job that they're doing. So if they're working in children's services, they will be undertaking some very different training that relates to their service to what I'd be doing working within HR. In terms of links that aren't working, we encourage people to contact us and tell us that they aren't working. Links break because sometimes courses move, the information moves, the e-learning moves, and we don't always know about it. So we would encourage them to talk to us, and we will fix those links straight away.
Yes, do you want to pick up that as well, please?
Yeah, thank you. Yeah, I guess your point around this sort of like 35 to 40 hours of learning and the ability for somebody to absorb that and it to make a difference. We've been looking at the induction process, and we've got some videos now that our senior leadership team have done. And really, the videos are more the visual concept of, you know, why do we work at MedPay, what are our priorities and what do we need to do? And we're in the position of moving some of that content to align to those videos, so there's a bit more, I suppose, purpose behind that, some of that learning. And the conversations we've certainly had as a team is, it's not about getting here on day one and crunching through it and have a protected week of learning, but can it be more staggered and what's the most priority? So we've had, within the workforce strategy, we've got induction as one of our key things that we know that we do need to improve. And I think we've got the content there, I think we've now got the visuals there, but perhaps the expectation. And again, the other thing we're missing that we need to build on is, what can we send to candidates before they join us to keep them warm, and what can they be looking at before they come through the doors? So again, that might not be the mandatory training, but again, if you're joining a service like Children's Services, there's quite a bit like the latest Ofsted report and things like that already in the public domain. So how do we draw candidates in early so that that first week isn't so overwhelming, because they've already had that kind of intro into that particular service area? So a number of improvements to make still, and acknowledging the point that that is a lot to take in one hit. Thank you.
Thank you. Don't forget that our induction programme isn't instant. We don't expect them to undertake it within their first day or even their first week. And we, as a L&D team, actually outline maybe a plan that they would work on. So we certainly say week one, there's an expectation of this what would need to be covered, and it certainly isn't everything. And then they would work to month one, month two. But yeah, there are certain ones, data protection, GDPR, they're very important ones.
Thank you. Councillor Hartwell, you wanted to come back?
Thank you. Just as a point of clarification, this policy that you're issuing is the 25 to 28 policy, so it's a 3-year policy. Is that the first time it will get reviewed again in 28? Because I look at the action plan, and 90% of those actions are due to be complete in 25. And I just wondered, as you're issuing a policy, should there be other actions that, I know it's very difficult to do, because once you think of this is a problem we need to solve, you want to solve it as soon as you can, and so you put it in an action plan. But as it's a policy that's meant to be lasting 3 years, I would have expected to have seen some that you're going to do in 2027 and stuff like that. That's not a criticism, but constructive comment, I hope.
Do you want to come back on that, sir?
Yeah, so I thought there was a governance piece in here that said we would do an annual review. So if that's missing, apologies, that's probably gone through iteration and has come out. But with all of our strategies, we will do an annual review, and the governance tends to be sign off. We'll go back out consultation, do that kind of update, if you like, and then we will request if EMC wish to see it, or if corporate management teams wish to see it, they can. Often the annual review is quite light touch because the commitments do go beyond that first year, and it is aligned to an overarching strategy of a workforce strategy, but typically there will be a light touch annual review. And again, that's because things can change. You know, our budget might get slashed, we might not have that budget, changes the whole plan, might increase even more. Fantastic. But yeah, there will be an annual review, but I'll make sure that's captured within the strategy as the governance part.
Okay, thank you. Is there any other member at all? No, thank you very much. I've very much welcomed this report, and you can tell by the answers given that there is a passion for learning and training our staff, because it's important you upskill your staff and hopefully you'll get more out of them, and the benefits are exponential for that. So thank you. I'll pass to the Vice Chair, please.
Thank you. So firstly, the committee is asked to note the Council's Learning and Development Strategy set out at Appendix 1 to the report, to note the proposed key actions in the Learning and Development Strategy and timescales for delivery in each case, propose other areas for improvement and associated key actions they feel are necessary to ensure our learning and development strategy enables us to meet the priorities and actions associated with the workforce strategy, recruitment strategy, One MedPay Council plan and the financial improvement and transformation plan. I've noticed that we'd like to pass our congratulations on regarding the work of the Apprenticeship Academy and the investment of the Apprenticeship Levy into the work of the Council, and that there was going to be the inclusion of a light touch annual review of this strategy, which is prepared and shared with the appropriate committee. I've also noticed that in the previous JCC, that the Unison Union welcomes this implementation, and there was a request at that meeting to explore the union training initiative. Thank you.
Okay, thank you. Is that seconded?
Seconded.
Thank you. Agreed? Agreed. Thank you. Okay, we move on to the last item of business, which is item 8, is the MedPay review update. And Sam Beck-Farley to introduce, please.
Thank you, Chair. So this report updates committee on the progress of the MedPay review. It's a specific focus between February 24 and June 25. The background of the MedPay review was set out to the Employment Matters Committee on the 6th of June 2023 with an evaluation of the Phase 1 considered at the 30th of January 2024. The MedPay review team are closely monitoring the impact of the review and also that of protected characteristics, and a full diversity impact assessment will be made available to this committee once all teams have implemented as part of the overall project evaluation. A final end project evaluation report will be reported to Employment Matters Committee in 2026, and this will be upon completion of all MedPay, which includes the senior leaders. Full backgrounds can be provided as a narrative in paragraph 4, and committee members are asked to note the update as is today. Thank you.
Thank you. Any member? Councillor Fern and then Councillor Atwell after, please.
Thank you, Chair. Yeah, a couple of questions, Sam. With regard to the final stages of the MedPay review, do you have any concerns regarding the project, especially with the single officer now working on it? Do you think that we're still going to complete and be ready with the conclusions for July 26, as you said, as it's already overrun? I mean, also the £5.9 million, the £4 million originally, and then the additional money that we added for the review. Do you think that is actually going to be sufficient? I know, so you suspect it will be. I recall reading in the report somewhere, but do you think that is actually going to be sufficient to cover it? And that does include any salary adjustments as well, if you could just confirm that. And the last question was regarding the last meeting. We discussed the pay approach and the banding levels. It's indicating that the corporate management team preferred the free band option, and sort of you indicated that was for greater job retention. Is there any feedback that you can give us based on the decision that was taken last time?
Thank you. Do you want to pick them up, Sam?
Yeah, thank you, Councillor Fern. So the first one around concerns of the project not finishing in July. The team are working incredibly hard. The service managers are responding really well. We won't scrimp on quality, right? So I think, we're putting the team still through the same quality assurance process. So every team now has a framework in place. The bits that we're working on now is the quality of those frameworks. So it's coming backwards and forwards with HR and the service managers. We've got a matter of 3 weeks to the end of July. We probably have maybe 3 or 4 teams that we've flagged as at risk, and that is largely down to capacity. So if something's happening in the service and the service manager isn't getting to make those changes as necessary. Corporate management team are fed into this. We discuss it at corporate management team as a collective, but I also work directly with the assistant directors and directors and ask them to lean in to see if there's any capacity that they can build into that to make that happen. And then the only other variable on that would be children's services, where we had Ofsted come in. We had a number of recommendations within that report that meant actually if we moved that time with the MedPay review, it would have kind of made those situations worse for a number of things that we need to do. So we decided not to rush with children's services. Children's services do have career pathways in place already, and most of what we were going to do was alignment. So it's safe to say they're still in a position where they can have career progression as the rest of the organisation does, because those were the team in the beginning that was the only team that had it, so to speak. So yes, there is still a handful of teams at risk, but very close to the finishing line. So it's not like we're starting the project from scratch and they haven't got anything there. So it's almost teething issues that we need to just get through, and it's capacity that's going to be the problem now. In terms of the funding, so this year how we've managed to do the budgets, typically your budget would be built on what you've got in your base budget. What finance have managed to do this year is give everybody a midpoint base budget, so a salary midpoint. So depending on where your team is, you get a salary midpoint. And that really is recognising the split that we wanted to have, which was the 20-60-20 split across the band. Now, services and managers are well aware that if all of a sudden they've got people all sitting at the top of the band, the skills are quite high. The question is then, do you need as many people? and that's how they make their budget work. So this year will be quite testing in managing that salary budget to make sure that we're still within those areas. HR monitor the percentage across those 3 levels to see where we are and if there's any particular teams at risk, and we work well with finance, really, with the business partner in finance to have those conversations with services. The key part to this is the business partners now coming back into HR, not being on the project, whereby then they can do some strategic workforce planning with those managers around this. So that's kind of the next phase, and that's why we need the MedPay project to be completely concluded in that regard. In terms of it being sufficient, like I said, that's how we've allocated the money. Most of the teams are through now. It has proved to be sufficient so far. We've got money that covers it. We still have the leadership stuff to do, and you wanted me to come on to that in a moment. We've got leaders who, because we've had to retain them, would be already occupying market premiums, for example. So the MedPay project, what that will do is either put people onto better base salaries within the band. We're not changing the bands, so we will convert some of those market premiums into better base salaries because it matches those skills assistants, and that will be a break even or slightly more. Or it will attract another skills allowance because the market is higher in that demand. So we're doing some of the forecasting on that, but we haven't been able to move into the senior stuff as fast as we'd want. But as we did with every phase of this, we would do an assumption forecast on the senior leaders and the risk, and then see what the budget situation is before we rolled out any kind of programme. So that bit is a little bit unknown, but given how many we've either got a retention payment on, a skills allowance, a market premium already, because the salary doesn't match the market, we're not anticipating big numbers. But it's unknown slightly. And then the pay approach, so we did have a big discussion last time around the 3 points versus the 4 points. We've had some other discussions outside of committee, particularly across officers and members who are concerned, just to really understand some of those risks that I was articulating in the meeting. And now a paper will go to full council on the 12th of July, which will just refine those risks very clearly within that paper for the discussion and decision on the night. In terms of our officers, there was disappointment. I mentioned it on the night that I thought there would be. There was disappointment. We're trying to manage that. We're trying to explain that this is it's not the final decision. We've still got to have the final debate on it. But I think people are just waiting to see what that might look like. And whatever it is, whether it's 3 or 4, we've just got to move really quickly with it and implement it, because managers have been waiting a long time for the same kind of principles as the rest of the programme.
Thank you. Councillor Hackwell.
Thank you, Chair. First question was really on the same ban. I am concerned that if you've got the 20-60-20 targets and you've got something like 40% sitting in the low band A, it's going to be expensive to move them into your target. And where's that money coming from? Because otherwise, how are you going to achieve that target? You're going to have to move something like 350 people into level B to get your 60%. So it's a tough thing, and it will cost money, I guess. The other thing that I have a concern about is that you've mentioned there's only going to be 1 officer left, and it should have been finished, but you've extended it another month already. But you're not planning to do the seasonal and stewards and occasional, and there's 430 of those people that need to be moved into MedPay. How's this one person going to manage 430 different people to move into MedPay? And are they going to get the same opportunity as the permanent employees or the full-time employees, and will there be opportunities for pay progression within those frameworks? If you re-evaluate a steward's job and decide that there should be danger money, I don't know, but they're not getting it, how are you going to move that forward, and where's that money coming from? So those are my couple of questions.
Thank you.
Thank you, Councillor Hackwell. So the first point around the percentage split, as it stands at the moment, bearing in mind not everybody's on the programme, what you've got in there is just the period of the report. But as an organisation, we're sitting at the A, it's 27%, at B it's 44%, and at C it's 29%. So the split is probably better than we anticipated, actually. We thought it would sway the other way. Where we've got the budget at midpoint, that is helping within the budgets to manage that. And then once the business partners come out of MedPay, they will be aligned to those directorate areas, and their role around that strategic workforce planning will be to drill down into this to really look at where that risk is, but overline it with something that we've got called the 9-box diamond, which is the 9-box grid to look at talent and succession. So that piece to make this work and to make it work well is going to be critical. So at the moment I have a MedPay project team still. I've had a couple of people leave because they were on fixed-term contracts, so the team has depleted slightly, and rightly so. They thought the role was coming to an end, and we've extended it. But my business partners, who are the senior business partners who need to do the workforce planning, are still very much aligned to the MedPay to get the last projects over. And the purpose then, when they go into their directorates, they will then pick up any legacy stuff. So they'll be working on the manager's framework, and they'll be working on the steward's casuals, and then whoever's aligned to children's will be working on children's. But it's got to become part of the day job and not a separate project team. So what they won't have behind them is additional project support that sets up the meetings, does the communications, you know. So at the moment we have this neat team, if you like, that do all of that, raise the risks. So we've had to reposition that team back into our business as usual. So within that we've created some new posts. So we've got somebody who's going to be doing the job evaluation and the moderating. So we know new posts will always become available, will always need to be re-evaluated. So somebody will have that as a post to do and constantly look across the market to see where we are. So we've had to change the shape of HR to future-proof this particular programme, so we don't do what we done last time, put a programme in and never really review it or look at it. So MedPay isn't over, I guess. Teams will be onboarded, but there will still be lots of work that we need to do, and that's why the evaluation won't come for so long, because those teams have got to go through their first kind of assessments, and we've got to look at what that means in terms of how many people progress, and is that been fair, and how we do that percentage check on some of those to make sure the evidence is there, and that's going to take some time to go through with the latest teams that are there. I think, yeah, so that I guess the re-evaluate bit, as I mentioned, we've got a staff member who's going to be picking that up as a role, who will work with the recruitment team. And the idea is the recruitment team will take on some of that role because they'll be doing much more of the market matching. We've also now joined South Eastern employers, so we get the opportunity to do some benchmarking. So we send in our roles, a lot of other local authorities send in their roles, and part of that will be to just do that regular temperature check. So we're not in a situation where people feel they've got to leave us because we're responding to that market. And again, if there's particular pots of concern, the way we operate through finance, if we're finding a pressure within the budget, we need to raise that really early in that year to think of that in terms of our medium outlook moving forward and capture it early. And that's why it's important we have that as a regular item.
Just to come back, and is it realistic that you're going to get through all 430 casuals by the autumn?
Depends what you're expecting us to do. The one thing we haven't done with this pay review is we haven't re-evaluated everybody's role, because we would have been at it for years. There's so many roles, we just couldn't have re-evaluated everybody's role. So one of the principles that was set out at the beginning of this pay review was we would re-evaluate if there was a retention issue or a market concern, or if there'd been particular issues where we were having to apply lots of allowances. So not every role has been re-evaluated. If we have no recruitment concern, no turnover concern, and we've done a light touch look against the market, then we haven't re-evaluated those roles. And again, the only other ones we've done is where the like ICT, as we spoke about earlier, where there's been significant change in the job, and then we would re-evaluate it. So the same principles will apply with the casual posts. We're not going to evaluate every casual post. Some of those are on spot rates. Some of our range ones are on spot rates. They don't afford a career pathway because it's a spot rate. We suspect range 2 will be in the same situation next year when the cost of living comes in, because I think there's only just over 1,400 in that pay band. So that is soon going to eradicate and become a spot rate. We know that the points to grade across our bands are not fit for purpose. We didn't pick this up as part of the pay review for two reasons. One, it would be very complex and very expensive to do, and would have thrown a absolute organisation into chaos. And two, because we had the ambition that we was going to return back to NJC, and it would have to be done at that point. Now, obviously, NJC is still on the table for discussions, but with LGR looming, it's a little bit unknown at the moment. But we recognise, even if you look at the percentage increases across all the bands, they're all very different. So the points to grade is slightly off and does need some work. Now, whether that comes as a phase 2 down the line, I'd say no, because it's probably going to depend what happens with LGR and where we align then. And that will be a big job at that point around lots of terms and conditions and where we stand contractually.
Thank you. Any other member? No? Okay, thank you. I'll move to the Vice Chair then, please.
Yeah, thank you. So the committee's asked to note the report and also the comment from JCC that it was noted that the diversity impact assessment was coming in 2026. It was requested that any trends coming up before that are shared for the committee's awareness, and the union offered support with any arising issues. Thank you.
Thank you. Is that seconded?
Seconded.
Thank you. Is that agreed? Agreed. Thank you. Thank you very much this evening. I close the meeting. Thank you.